my role is to be the liaison between public health services and primary health care. And those two services are very, very closely aligned because public health also sees a lot of frontline primary care kind of conditions, and some of the reportable diseases come both to public health and to primary care. So we always try and collaborate in terms of taking care of the patients.
How do you close the loop on test results?
Well, there are many examples of how we close the loops. So one is if it's an urgent infectious disease that has been recently tested and diagnosed, we make sure that the family physician has received their copy of the result. And then I discuss with the family physician a joint plan on how we're going to take care of this patient. Some patients we can offer treatment directly in public health because we do have a primary care service. But some patients who are very complex, and I think this might be the interesting piece, there are some patients who we do have the diagnosis, but they need to be treated in their doctor's office. So we make sure that we close the loop and have a plan for these patients to be treated because with communicable disease, there's some urgency in getting the treatment done and getting the treatment done properly and safely. Well, the way it's done in a timely manner is part of the system design. When we get a reportable positive result, so within the Public Health Act, there's a list of reportable conditions. Both the family physician and the public health physician are informed at the same time. So what we do is I always make sure we call the physician who's taking care of the patient and discuss how are we going to manage this patient. There's the treatment of the patient and then there's the treatment of the contacts. I take care of the public health piece, the contact tracing, while the family physician would normally take care of the patient who is their patient.
Is that a difficult process, taking care of contacts?
Not always, not always. I think when we explain the reason why, in fact, it moves quite nicely. But it can be challenging because with some diseases, some contacts are difficult to find. I think working in this way is a really good safety net because some of the things that we might find, it's not always that a patient only has one disease condition. It might be a communicable disease, but they may also have other chronic infections, or they may be on treatment or cancer therapy. And I think it's always important to check in with their family physician, who is like their quarterback for their medical care, to make sure that the right decisions are being made and all the other medical care providers are informed of what we're trying to do. So I think it's the safety aspect of this is important for us to recognize as well.
Do you have any recommendations for family physicians and specialists in Saskatchewan on how they can close the loop better and in a more timely manner?
Yes, I think the one thing that I would really appreciate is, family physicians should feel free and comfortable in calling their local medical health officer. We are their resource to help them with the public health conditions. And the public health conditions are actually published and written in the Public Health Act. So you can call us anytime and you can ask assistance, particularly the contact tracing. Family physicians have a limited amount of time to treat the patient who's come in to see them. We have the mandate to go and look and treat contacts in the community. And some of the contacts might be in a public place like a coffee shop. And I don't think family physicians would have the time to go looking for people who were in the coffee shop at the same time. So that's where we play our role. And I think that collaboration is good in terms of safety for the whole community.